Hello friends, welcome back to my channel Dental Lovers. First of all, I want to thank you all for such a lovely response on my old videos. I am so glad that you all like it so much. Thank you so much guys. Today we will do one of the very interesting and important Viva question, that is the ophthalmic nerve. So we know the fifth cranial nerve, that is the trigeminal nerve. So the trigeminal nerve has three branches: ophthalmic nerve, maxillary nerve and mandibular nerve. The ophthalmic and maxillary nerve are completely sensory. Mandibular nerve contain both the sensory as well as motor fibers. We have already discussed about the maxillary and the mandibular nerve. If you guys don't have seen those videos, link will be in the description. Please do watch. Today we will discuss about the ophthalmic nerve. The ophthalmic nerve mainly had three branches: nasociliary nerve, frontal nerve and the lacrimal nerve. You will remember it as NFL. N stands for nasociliary nerve, which is the medial most nerve. Medial means it is more towards the midline of our body, and the L, that is the lacrimal nerve. L means lateral, L means lacrimal. So you will remember it like it, right? So it is the lateral most branch. Now let's first come on to the first division, that is the nasociliary nerve. The nasociliary nerve is further giving various branches. So the first division is the long or sensory root of ciliary ganglion. So this root contains the parasympathetic fibers from the superior cervical ganglion along the vertebral column, and these fibers goes into the ciliary ganglion, and via the short ciliary nerves they enter into the eyeball. These supply the dilator pupillae muscle and help it to dilate, right? Coming on to the second division, moving forward, here these are the long ciliary nerves. These are 2 to 3 in number. They mainly supply the iris and the cornea. Now moving forward, there is a small division here, which is your posterior ethmoidal nerve, which via the posterior ethmoidal foramen enters into the posterior ethmoidal canal. So these supply the posterior ethmoidal cells and the sphenoid sinus. Moving forward, there is a division, that is the interior ethmoidal nerve. So this interior ethmoidal nerve, when enters into the canal, it mainly gives two branches. One is the internal nasal nerves and external nasal nerve. Internal nasal nerve further are lateral and medial. Medial supply the upper mucous membrane, whereas the lateral supplies the superior and the interior part of the nasal concha. Whereas the external nasal branch supplies the tip of the nose, ala of the nose, skin and the mucous membrane in this region, right? Moving forward, finally it ends while giving the infraorbital nerve on the medial most side. So this is all about the nasociliary nerve. Now here you can see this nerve. So this is your cut section of the frontal nerve. This nerve is the largest division of this ophthalmic nerve. It further gives two branches. One is your supratrochlear nerve, another one is your supraorbital nerve. So the supratrochlear is more medial and supraorbital is lateral compared to that. Further give anterior and posterior divisions, and it supplies up to the vertex region, which is the highest point on your head. Now the lateral most division, this small division, this is your lacrimal nerve. This travels on the lateral side and supplies the lacrimal gland. We very well know this, that there is a communicating branch coming from the zygomaticotemporal nerve, which contain your parasympathetic fibers, travels via this lacrimal nerve and supplies the lacrimal gland so that it can secrete its various secretions. So this is all about the ophthalmic nerve. The ophthalmic nerve has three branches: nasociliary, frontal and lacrimal. Nasociliary has further branches. One is sensory root to ciliary ganglion, then long ciliary nerve, then the posterior ethmoidal nerve, anterior ethmoidal nerve and infraorbital nerve, whereas the frontal nerve has the supratrochlear nerve and the supraorbital nerve, and finally the lacrimal nerve.